Hello, welcome to Preg Fertility Clinic. I'm Dr. Erickson. Today we are going to discuss about frequent question that bothers pregnant women, and which is, why should I go for antenatal care? Please, I will encourage you to share, subscribe to my YouTube channel. Antenatal period is a very important time, and is a period whereby different kind of treatment, modification, education, talk, different things go on. And all this care offered to these pregnant women is geared towards making them have a healthy pregnancy period and also have a healthy baby at the end of the pregnancy. So the benefit of antenatal care ranges from the fact that during antenatal period, we can institute preventive measures as well as identifying risk and treating some diseases that are common in pregnancy. And as well, these women are given education, health education. They're giving health education because there are a lot of changes that occur during that period, and they need to know reason why there is changes or the body does not feel the way it used to feel before. Now, in terms of prevention, during antenatal period, because we know that pregnancy tends to cause anemia. Anemia means that the level of the blood tends to get lower. And reason why the level of blood tends to go lower is because the iron that is involved in making blood, some of them are transferred to the placenta and from there to the baby. So it's like the woman is also providing support for another life. So for such reason, the woman needs to be on iron supplements. And for women that undergo antenatal care, who are prescribed routine antenatal drugs, have that benefit of having this care and preventing them from having anemia. As well, the other areas of prevention, especially in Africa where malaria parasite is prevalent, these women are advised to sleep under insecticide-treated nets, and by so preventing mosquito bite and preventing malaria. And as well, certain other drugs are given for prevention. Some drugs, malaria drugs, which are used for prevention, are given, and these drugs are the drugs employed in what we call intermittent preventive treatment for malaria. This is 3-in-1 drug given to these women, and it also helps in prevention of anemia and malaria, which can also subsequently cause anemia. Now, other things that can be prevented, especially for those living in area where there is deficiency of some certain nutrients, calcium supplementation is also important. Okay, so in terms of identifying risk, there are different kind of things that can happen during pregnancy. A pregnant woman may have spotting. Some of those spotting can be salvaged when they present to the hospital, and a pregnant woman can bleed later in pregnancy. And when such is identified, death and mortality can result from such bleeding can be curtailed. As well, there are also issues that need early identification. Such risks include when the baby is not kicking the way it used to kick. In such circumstances, it may be a pointer that there may be something wrong with the baby. And if the baby pregnancy is close to term, that means the pregnancy is mature. In such situation, we have to deliver that baby to ensure that the baby does not die inside the womb. And in terms of treating pregnancy-related conditions, which can be identified during antenatal period, during pregnancy, some group of women tends to develop hypertension, which are very dangerous if not well identified and proper managed. This can be identified during antenatal care, and such bad outcome from such pregnancy-related events can be prevented. So there are very wide arrays of benefits. There are plenty benefits of antenatal care, and because of these benefits, it's important that every pregnant woman should enroll for antenatal care. Lastly is the health education. There are changes that come with pregnancy. Some women tend to eat less, some tend to have constipation, some tend to have swelling of the whole body, either the foot, the thigh, even sometimes up to the face. Then there's an issue of weakness, back pain, even some psychological and emotional problems. So such women, when they have proper knowledge of those changes that occur in pregnancy, which some of them are not disease, but due to the fact that the body is adjusting to take care of second life, which is the baby. So sometimes education on different topics are given. For example, a woman that is vomiting too frequently due to pregnancy, education can be given on why that happened and remedies that can be given. Some other health talk may include on how they can take care of their baby when they deliver, or some other health talk can include on what is safe during pregnancy in terms of food or drugs, on even telling them to avoid over-the-counter medication as much as possible. So with a woman that have passed through antenatal care and have ensured that she have had maximum utilization of this care, and also attending the antenatal visit based on appointment, we have so much benefit that end of the day the pregnancy outcome is very, very, very good when compared to those that didn't attend antenatal at all. So thank you very much for listening.